So mental health terms can be used interchangeably in conversations, but there are important distinctions between them. This afternoon, Dr. Brenda Lloyd Jones from the University of Oklahoma is here to discuss the differences between stress and anxiety. Dr. Brenda, thanks for being here. We appreciate it. So most people may assume that stress and anxiety are synonymous with one another, but they're not. So what is kind of the big differences between stress and anxiety?
Hi, Jonathan. Yes, there are some distinctions between the two, while there are overlapping areas. But let's start with stress. And stress is a typical your typical body's response to threat, dread, or even change. And you may feel increased heart rate or perspiration due to some type of stressor. For example, you can be stressed because of responsibilities related to work, school, even home. These responsibilities cause pressure. You know, some people use stress to motivate them, and they look at deadlines, for example, as pressure to help them get things done. So it's really how a person responds to the stressor. Now let's look at anxiety. Now anxiety is excessive worry that persists. The operative word is excessive worry that persists, and that causes you to somehow not keep up with your normal routine. With the intensity, it can play a factor in causing you to, or maybe even causing you to rethink what you've already done, or be somewhat bothered unnecessarily, where you would not have been if you were just feeling some type of stress. And so the key piece is to know that intense worry that persists, that is a signal that you may want to talk with your physician. You certainly can think about meeting with a mental health professional to get more information, but you want to be careful of the two.
Yep, definitely important, because it is very common too. And then another stigma around mental health is about suicide prevention. It's an important topic. We don't talk about it a lot, but what are some of the warning signs out there that people should be aware of?
Yes, and you know, in the media of late, there has been much attention paid to recent suicides, and some behaviors that you want to be cognizant of is this notion of talking about suicide, especially if the behavior is new, it has increased, or you assume that it is associated with a recent loss or a traumatic event. So they may begin talking about feeling like a burden, feeling threatened, feeling as if there's no sense of living, increase in alcohol use or drug use, a sense of alienation, isolating and withdrawing from others, acting or behaving recklessly, other types of behaviors that you want to be sensitive to. Here's the heart of the matter. Should you be alarmed, or you need to be on alert, and there is help, because there's the Suicide Prevention Center that can provide additional help, additional signals, and certainly provide assistance with this particular area, this phenomenon.
Yeah, and that's a good segue. 988 is a good number as well, but we do want to mention that if you know someone who is dealing with a mental health issue or thoughts of suicide, we want you to know you are not alone. Here are a few local organizations standing by ready to help right now. Dr. Brenda, thanks for being here. We'll be right back after this break. Stay with us.